Hello, my name is Dr. Parul Kaur and I'm a medical and surgical glaucoma specialist and cataract surgeon here at Georgia Eye Partners. So you've been diagnosed as having glaucoma and may need a glaucoma surgery called a tube shunt surgery. The following video will provide you detailed information about this surgery. Tube shunt surgery is an outpatient procedure, meaning you do not spend the night in the hospital. The surgery is performed right here at our privately owned surgical facility center, which is connected to our north office building. You will be given a map and detailed instructions as to how to get here. The surgery takes me approximately 1 hour to perform. You are not placed under general anesthesia for the procedure. You will have an anesthesiologist in the room giving you medicine through the IV to make you nice and sedated. I will give you a lot of numbing medicine around the eye. This is not a painful procedure. Glaucoma is a disease where your eye makes fluid but does not drain that fluid fast enough. Therefore, fluid backs up in your eye and results in a buildup of pressure. The medicines that you are currently on try to get the disease drain of your eye to work better, and at some point these medicines simply do not do enough. At this point you will need a glaucoma surgery. During the time of the surgery, I bypass the disease drain of your eye and create a brand new alternate surgical drain for you. If this is your eyeball here, and this is the colored portion of your eye, and this is the pupil, this is the white portion of your eye, and here's your eyelid. For the sake of the drawing, let's say we're talking about your left eye and your nose is here. The surgery is performed up top and by the temple of your eye. It is completely covered by your upper eyelid, so no one can tell that you had the surgery done. During the time of surgery, I insert a device into your eye made of silicone. It's called a tube shunt. The tube shunt consists of a teeny tiny tube that sits in the front of your eye. This tube is microscopic. No one can see the tube when they look at you. You cannot see the tube when you look in the mirror. The tube snakes back along the wall of your eye where it connects to a plate. The plate sits underneath the muscles of the eye, and the muscles of the eye hold the plate in place. Now, all the extra fluid that your eye creates will go through the tube, out the surface of the plate, where it will collect in a bubble that I'll create using the skin of your eye. Blood vessels that naturally live on the front of the eye will go to the bubble and take the fluid away back to your brain, then back to your heart, the way it's supposed to drain. The activity restrictions after the tube shunt will be in place for several weeks. These will include no bending over past the waist, no heavy lifting, no strenuous activity, and no eye rubbing. You will wear a shield at night when you go to bed for several weeks after the surgery, and you will be on a set of postoperative or healing drops for a month or two after the procedure. The follow-up visits after the tube shunt surgery will be performed with me. You will see me the day after surgery, 1 week after surgery, 3 weeks after that, another 3 weeks, another 3 weeks, and then we will start spreading the visits out. You'll come back a month later, approximately 2 months later, and then you will be back on your every 4-month cycle. The follow-up visits are approximately 5 or 6 in the first 3 to 4 months after surgery. Glaucoma surgery is a cutting surgery, and therefore there are some important risks for us to talk about. These risks include infection, so you will be on an antibiotic drop for a week after the surgery, bleeding inside the eye or on the front of the eye. This usually resolves on its own in about 2 to 3 weeks. The pressure inside the eye might end up a little bit too low. Once I put the shunt in your eye, it will work as well as it wants to work, and sometimes it works too well. That's okay. There are lots of things I can do to raise the pressure back in your eye if it does end up too low. Some people notice that their upper eyelid droops after the surgery. This is usually temporary, resolving in approximately 6 months. However, yours might be more permanent, and if it is, a future lid procedure can be done to raise the eyelid back to its normal position. Because the shunt is tucked underneath the muscles of the eye, you may notice some double vision after the surgery. Again, this is usually temporary, lasting only 1 to 3 weeks, but may last longer. If it does, a muscle surgery can be performed on the eye to realign the muscles, getting rid of the double vision. Finally, anytime I do any surgery to the eye, I always list vision loss as a possible risk. The most common reason for vision loss after this surgery is that you will start to develop a cataract in the eye. The cataract is a reversible cause of vision loss. The cataract can be removed after the surgery, and any vision you've lost from the cataract can come back. The second reason for vision loss after the surgery is that the surgery itself is stressful to the nerve in the back of your eye. This is the nerve that we are trying to protect. Sometimes your nerve does not bounce back from the stress of this surgery. The chances of you losing vision from the surgery are low and much, much lower than the chances of you losing vision without the surgery and with continued elevated pressures. However, this small risk of vision loss is important for me to communicate with you. The final thing that I'd like to discuss is the success rate after this surgery. Unlike a surgery such as cataract surgery, where I can give you a 100% guaranteed chance of success, I cannot give anyone a 100% guaranteed chance of success with a tube shunt surgery. These shunts can fail at any time. The reason these shunts fail is your eye can develop scar tissue here inside the shunt or here at the level of the bubble. If your eye develops enough scar tissue, it scars the surgery down and it's as though we never did the surgery. I will give you lots of medications at the time of surgery and afterwards to keep you from developing the scar tissue, but I cannot guarantee 100% that this will not happen. The maximum time you can get out of your tube shunt is approximately 10 years. I would be thrilled if we could get a decade out of this surgery. It is also possible that your surgery might only last as little as a few months, or 2 years, 4 years, 6 years, any time in between. If your surgery does fail, I can always do another glaucoma surgery to your eye. People with advanced glaucoma, on average, have 2 to 3 surgeries per eye. Of course, we will do everything possible to make sure this surgery is as successful as I can get it to be and lasts as long as I can get it to last. Part of this involves me using a special type of shunt in your eye. This shunt does not work initially. I purposely tie the shunt off in order to keep it from working in the first 4 to 6 weeks after the procedure. After 4 to 6 weeks, your shunt will open and then it will begin working. The reason we are using this kind of shunt is because it lasts longer and works better than other types of shunts. For this reason, initially after the surgery, you may be back on the glaucoma medicines. Once the shunt opens, your pressure will decrease. I will take you off the glaucoma medicines, and then everybody who has a tube shunt will go through a hypertensive phase where the eye pressure will go back up and remain elevated for a few weeks to a few months. I might need to put you back on glaucoma drops during this time period. Eventually you will come out of the hypertensive phase and then your surgery will be complete. The chances of me getting your pressure where I need it to be with the surgery alone and no eye drops is approximately 75 to 80%. The chances of me getting your pressure where I need it to be with the surgery plus 1 or 2 glaucoma drops afterwards increases to approximately 80 to 90%. So the chance of success is well over 50%, but it is not 100%. Again, I'll do everything possible to make sure your surgery is as successful as I can get it to be. Please don't hesitate to watch this video again if you need to. I'll see you soon.